Hey Dan,
Hi, Jerrod.
how you doing, my friend?
Doing all right. How are you? Oh,
Oh, so far so good. It's cold here. It's gonna get really cold this week in Minnesota.
how cold?
It'll be 20 below on Thursday, the actual temp.
Wow.
Oh yeah, gonna be quite interesting. So
Good luck.
thank you,
Yep.
thank you, thank you.
Gotta
We'll
wear those
check in
layers.
later about the other email I sent you regarding the publication and stuff, so I can give you a full overview.
Yeah, thank you. I was gonna mention that. Glad you did. So, that issue that I had brought up about the how brain injured people see one thing, but people without a brain injury see it differently.
Yeah.
So I've realized I have many, many examples of this. So I think I'm gonna like compile it all and kind of, I don't know the form that it will be, but to demonstrate the nature of this divide between what people with brain injury have and what otherwise people think about.
And this will be another topic that highlights that too, I think. If
Yes, I agree. I agree. I mean, it's sort of a part of the bigger issue, and it's actually what I'm trying to figure out how to challenge or confront or bring up. Okay, I'll get started. Hi everyone, thank you for coming. So this is the Building Brain Awareness talk series, and the goal of this talk series is to discuss topics that are brain injury centric. And today, it's a very interesting topic. Dr. Jerrod Brown is going to present about brain injury and the autonomic nervous system, different ways in this system can get injured or have some form of dysfunction. And I've met a number of people with these kinds of problems. Some of them look like other disorders like POTS or dysautonomia. And for some people, it's very strange and they have to learn how to deal with it, how to both make sense of it and then work to improve it or work to manage it. So I'm looking forward to this presentation.
Dan, thank you so much for
Thank you.
having me back. Good day, everyone. Thank you so much for tuning in to today's talk. So, I do a lot of work in the area of neuroscience, and a big neuroscience topic is the autonomic nervous system. Another big topic is traumatic brain injury, and we're going to do our best to tackle these two big topics here. Here's my email on the first slide. Reach out if you have any questions. I will always get back to you. Here's a copy of my brief professional biography. I have a PhD in psychology. I have 6 different master's degrees. A couple of my master's degrees are in clinical neuroscience. I have one in applied clinical nutrition. Do a lot of work in the area of brain injuries, lots of publishing, consulting, go on lots of different podcasts, and hopefully you'll walk away with some good practical information that you can use in the good work you're doing. If you're in the helping profession and you're working with folks with any kind of clinical, psychiatric, neurocognitive, physical health issue, you're probably working with folks that are dealing with autonomic nervous system dysfunction on a semi-regular basis. Our agenda is straightforward. We have 3 different sections. I'll park the brakes at the end of each section just to see if we have any thoughts, and then I'll stick around at the end, answer any other last minute questions you think about. So, part one, give you a broad overview of traumatic brain injury and the autonomic nervous system. Part two, how is this information applied to an intake, interview, screening process? Part three, tips, strategies, solutions, interventions. I'm going to talk about some heavy duty topics today. Please consult with healthcare providers, qualified professionals before implementing this. This is just for educational purposes only today. So, when we get into the autonomic nervous system and traumatic brain injury, I'm going to first start out by talking about it within the context of brain injury and then jump into general discussions about the autonomic nervous system. Many studies have been published on this topic within the context of traumatic brain injury. And I know Dan always sends out my slides. At the bottom of each of my slides is my full citation. So all this comes from empirical based research findings. The takeaway point here is if you have a brain injury, or if you work with folks with a brain injury, a lot of the research said that moderate and severe types of brain injuries you're probably more likely to experience autonomic nervous system dysfunction. However, plenty of studies have come out in recent years showing that a mild traumatic brain injury, concussion, can cause dysfunction of our autonomic nervous system. We don't have time to get into the weeds in terms of all the types of different autonomic nervous system disorders. So I'm going to try to talk more generally. You can have autonomic nervous system dysfunction and not have a full-blown autonomic nervous system disorder. And we'll talk about that today. Another study that really highlights, I think, why we want to understand the autonomic nervous system when you're learning about brain injuries is the fact that it is interconnected with headaches, anxiety problems, cognitive impairments, such as like executive functioning impairments, mood-related disturbances, depression, sleep issues. Dan and I have done different talks on many of these topics, and I know I'm doing many more this year for him, and we'll get into the weeds of these things. But if you are really wanting to try to understand why do folks with a brain injury deal with high incidence of headaches and cognitive impairments, anxiety, sleep issues, and the list goes on. If we look at this complex puzzle, we have to also learn about the autonomic nervous system. It's not the only thing going on, but it is a big driver for a lot of these other comorbidities. And we'll get deeper in the weeds with this, but just showing you visually here how complicated a traumatic brain injury truly is and why it's so important to work with specialists who understand these topics. And typically it's going to involve a team of people. It's not going to be one person who probably understands all of these intricate details here. But you can see here from this particular slide, when someone sustains a traumatic brain injury, that in and of itself can really trickle down and impact all kinds of systems in the human body. Respiration, our heart, our gut, our metabolism, and our autonomic nervous system, which we're going to highlight today, and it can impact our immune system. So it gets very, very tricky. And when we're talking about management and intervention, it's probably a good idea to work with a multidisciplinary team of professionals who can work with the individual to really piece together an intervention plan that really takes into account the unique circumstances that particular person is dealing with. Other things just to consider here when we're talking about autonomic nervous system dysfunction, you want to be aware of the term dysautonomia. And at its simplest terms, basically what that is dysregulation of our nervous system. And you can find all kinds of articles, websites, things of that nature that talk about very specific disorders that fall under that umbrella. But you can also experience dysautonomia and not be dealing with a full-blown kind of autonomic nervous system disorder. This is not an all-encompassing list. There's a lot going on here. I think some of these are very self-explanatory, but let's break this down briefly. When somebody with a brain injury is dealing with dysautonomia, autonomic nervous system dysfunction, this is going to overactivate our sympathetic nervous system, kind of that flight, fight response. And for some people with a brain injury, again, everybody's different, you might see higher levels of tachycardia, which are basically abnormal heart rhythms. So somebody might experience chest pain, discomfort, lightheadedness, and many other things. So very, very important to obviously work with a neurologist and a cardiologist in a lot of cases when someone with a brain injury is dealing with these kinds of things. What is this one here? If you take a look at the second one, a lot of people probably are not as familiar with this one. Basically, in a nutshell, this is going to be more breathing related problems. So more shallow breathing. Maybe someone feels like they can never get a full breath. Again, another big reason why we want to work with neurologists and cardiologists. Hypothermia may be a factor, hypertension, and the list goes on. Obviously, there's a lot more going on with this, but these are a few things you would want to be aware of when you're studying this within the context of a brain injury. Breaking it down a little bit further here, so making it visual here. Everybody with a brain injury is different, unique circumstances, but these are some of the common things that someone with a brain injury might experience when you're dealing with dysautonomia. It can impact blood pressure. It can impact respiratory rates, temperature regulation issues. I hear this a lot on cases I consult on where a person feels really, really hot, really, really cold. They might have more agitation. Some of these things may be driven by dysautonomia. The research is also very clear on this. There's not a lot of specialists out there in the world that truly are experts in the autonomic nervous system. There are many still, but we need way more. And if you look at the research specifically to traumatic brain injury and autonomic nervous system dysfunction, it says dysautonomia is oftentimes undiagnosed and undertreated. And that's a big reason why we want to bring this talk to all of you today. It's a real issue. And in a lot of cases, it might not be on the radar of a lot of professionals that folks with brain injuries work with, even though people with a brain injury are frequently dealing with dysfunction on some level in their autonomic nervous system. Let's break it down a little bit more, make it more visual here. Another good article that talks about when somebody with a brain injury, it can be mild, moderate, or a severe type of brain injury, when they experience autonomic nervous system dysfunction. These are four other major variables to take into account that make this even more complicated. So neuroinflammation, basically on its simplest definition, there's more inflammation in the brain and in the spinal cord. Oxidative stress, that is an imbalance between free radicals and antioxidants. It's very common among people that are dealing with high levels of stress, people that don't eat healthy, people that smoke cigarettes, use drugs, but it's also very common among someone who sustained a brain injury. For some people with a brain injury, they may also have reduced cerebral blood flow, where you're not getting the proper blood flow, you're not getting the proper spinal fluid going on in the body and the brain, and that can lead to a whole nother can of worms. And in some cases, depending on the brain injury, depending on if it's one brain injury or has it been multiple head injuries over a long period of time, that could also play a role in speeding up the neurodegeneration process. So, from a holistic, integrative lens, these are four other big variables to take into account when we really want to help manage the after effects of a brain injury and how it can impact our nervous system. Dan, before I get into the weeds with just the basics on our autonomic nervous system, thoughts, anything you want to weigh in from your lens?
Um, Across what you were saying, I just wanted to add or to mention that, I have several of those problems, and I never thought of it as a product of injury to my autonomic nervous system, but managing blood pressure and just being too hot and super agitated. People don't understand why I'm dealing with that, and I have to like shed a bunch of layers. But I think that what you're describing are good examples of it. Really, in this case, has to be thought of as injury to this kind of system that the person is left to deal with, and that's true for many brain injury problems overall. But I thought those were good examples. I know some people here that I invited that have these kinds of problems. They are here. I don't know if anyone wants to say anything. Otherwise, I don't have any questions or comments. Anyone? If not, yeah, maybe we'll get to it later.
Yeah, no problem. Well, our autonomic nervous system, I mean, this we could literally spend a whole year studying the autonomic nervous system and still have tons of things we need to learn about. But Let's just do a basic overview of our nervous system. So think of our nervous system. We have that umbrella. If we break apart the umbrella, one side of that umbrella is our central nervous system, which is the brain and spinal cord. The other component, the peripheral nervous system, which could, if you break that down even further, we have sensory neurons, which communicates with our central nervous system. We have motor neurons that communicates with our central nervous system. And then if we break that down even further under the peripheral nervous system, we have the somatic nervous system that plays a role in voluntary movements. And then we have the autonomic nervous system, and that controls involuntary functions. So basically, when you see this term autonomic nervous system, it's really controlling autonomic functions that we're not even aware of. And when we study the autonomic nervous system, we need to understand that there are two components. We have the sympathetic, the fight or flight, and we have the parasympathetic division, the rest and digest. Any of you who've ever studied trauma, you probably have had tons of training in those two components. But the autonomic nervous system plays a major role in almost every body system in the human body. And why is this system impacted so frequently when somebody has a brain injury? Well, this system absolutely relates to our brainstem, our cerebellum. Those are just two small components that you need to be aware of in the brain that can be impacted, obviously, by a brain injury. And when those components of the brain are impacted from whatever kind of force that caused the brain injury, that is the most simplified definition I can give as to why autonomic nervous system dysfunction is so common. There's way more to it than that, but those are a few variables you'd want to take into account. Take a look at this. It is meant to be overwhelming, but let's just sit on this slide for a moment. What role does the autonomic nervous system play in the human body? Well, as you can see here, all kinds of things. Reproduction, digestion, circulation, our endocrine system, it plays a role, our metabolism, our mood, our circadian rhythms. Dan and I did a talk on circadian rhythms last year and its relationship to brain injury. This is a very small visual of all the things that the autonomic nervous system plays a role in. And that is a big reason why when somebody has damage or dysfunction with their autonomic nervous system, you may experience symptoms in a variety of areas. Another reason why I love learning about the autonomic nervous system, and I do think it is foundational if you're working with clients in any capacity to learn about this topic. When our autonomic nervous system is working properly, it plays a huge role in our overall well-being, not just physical well-being, but emotional and psychological. So if any of you are working in mental health treatment or substance use treatment, you're working with folks all the time with autonomic nervous system dysfunction, which can trickle down into impacting their emotional, psychological, physical, and social well-being, to name a few. Our autonomic nervous system is a major indicator of health. So when our autonomic nervous system is not working properly, that's an indication of poor health. When it is working properly, that's an indication of good health. So anyone trying to enhance their overall health and well-being, regardless if you have a brain injury or not, the more you can understand the system and the more you can help regulate it, you're only going to feel better. You're probably going to sleep better. Your outlook on life is going to be better. Your anxiety is going to be lower, and the list goes on. If you work with folks with illnesses, diseases, impairments, disorders, whatever it is, not just a brain injury, this is a major topic to take into account. If you work with folks with diabetes, you work with folks with bipolar disorder, if you work with folks with chronic pain conditions, migraine, digestive health issues. The research is very clear that the overwhelming majority of those individuals have an autonomic nervous system that's probably not working at optimal levels. Let's break it down a little bit more here visually. If you work with people that have a high degree of anxiety, panic disorders, social phobia, post-traumatic stress disorder, ADHD, autism, and the list goes on. Research leans in the direction that a very high percentage of these individuals that carry these diagnoses have an autonomic nervous system that's not working at optimal levels. And we know from brain injury research, a very high percentage of folks with brain injuries deal with anxiety, deal with post-traumatic stress disorder. ADHD-like symptoms are very high among many people that have sustained a traumatic brain injury. When you study the autonomic nervous system, it is imperative to also at least have a basic understanding of the gut-brain axis, the microbiota gut-brain axis. Dan, correct me if I'm wrong. I think I'm doing a talk for you on this very topic in 2026 in
Yeah,
relation to brain injury.
I agree. I don't remember the date, but that was one of the other topics we're hoping to cover. So, yeah, to I will be posting those dates soon, but I agree.
Another huge topic to be aware of. And if somebody's dealing with gut-brain axis dysfunction, that impacts their autonomic nervous system and vice versa. So basically, in a nutshell, the human body is so interconnected, and the more we can understand these different systems, and the more we can work with specialists who understand these systems to help them regulate more effectively, it's only going to help the person improve overall functioning and health and well-being. So the gut-brain axis, part of that is the gut microbiota. So when our gut is working properly, and the gut microbiota is the communicator of the gut-brain axis, it communicates with our autonomic nervous system. It communicates with our neuroendocrine system, a lot to do with hormones. It communicates with our immune system. And then our enteric nervous system. This is the nervous system of the gut. It's all interconnected. So if one is off, it likely impacts the other. And there's plenty of research in the brain injury world that points to the fact that a lot of these systems are impacted by a brain injury. This is interesting here. So if we put on our attachment theory hat right now, really interesting stuff. I do a lot of work in the area of attachment theory. If you're ever working with somebody that has a long history of early childhood trauma and they have fractured attachment patterns, those factors in and of itself may actually adversely impact the autonomic nervous system, which can also impact the HPA axis, which is the hypothalamus pituitary adrenal axis. This is the human body's main stress response system. It's a hormone regulator. Any of you here work in the area of like early childhood trauma, child welfare? If you work with folks that have had a history of prenatal drug, alcohol, tobacco exposure, very, very important to understand the interconnectedness between these things and early childhood trauma. So again, I pointed this out earlier. So when we're talking about autonomic nervous system dysfunction, in the research literature, it's been referred to as autonomic dysfunction or dysautonomia. So I would definitely write this term down, Google it. There's all kinds of wonderful short videos you can find on YouTube, lots of good stuff. And again, when we're talking dysautonomia, we're probably having an overactivation in the sympathetic nervous system, which we want to have balance between these systems. So PNS is the parasympathetic nervous system. When these are out of whack, the person is more out of balance in their body, and that can lead to all kinds of things, anxiety, sleep issues, unmanaged for fear. The sense of impending doom actually is linked with more autonomic nervous system dysfunction. Breaking this down here, so again, dysautonomia is a big, big term. We're not going to get in the weeds today talking about the different types of actual dysautonomia types of conditions. I'm sure most of you have heard of POTS, and there's all kinds of other disorders out there, orthostatic hypertension, autonomic dysreflexia, and there's so many to count here. But practically speaking, when somebody's dealing with dysautonomia, fatigue, very, very common, more cognitive dysfunction. You might have more issues with exercise intolerance. You might have more lightheadedness, more dizziness, especially when standing up. You might have more heart palpitations. Breaking this down even further, making it visual here, dysautonomia can be linked with more insomnia. So anytime we're trying to tackle insomnia among someone with a brain injury, I think it's imperative to work with somebody who really understands dysautonomia because I bet it's a big driver for it. It can also trigger more constipation. I'm actually doing a lot of work in the area of constipation in terms of developing trainings on this for different groups. It's a huge issue, and there's actually some literature that supports the fact that having a traumatic brain injury may actually trigger more constipation. It can play a role in headaches, blurred vision, and the list goes on. Breaking this down even further, anybody can be impacted by autonomic nervous system dysfunction. It can be young children, teenagers, adults, older individuals. It can impact males, females. It doesn't just impact someone with a brain injury. It can impact people without a condition, and maybe they're dealing with post-COVID symptoms. You're finding tons of literature now coming out talking about post-COVID dysautonomia. Lots of good studies on that. When I got COVID, I've had COVID a few times now. I am 100% convinced after I had COVID, I was dealing with dysautonomia for probably a few weeks after COVID, where my sleep was really off and my mood was off. It was really weird, and I never experienced that before. I think I experienced dysautonomia as a result of post-COVID. People that eat really unhealthy again, maybe they're dealing with burnout, high levels of stress. All of that can lead to more autonomic nervous system dysfunction as well. From a behavioral lens, again, anybody working here in the area of mental health treatment, anybody's working in the criminal justice arena, anybody works with people that just have a lot of mood instability problems, take a look at this. And again, this comes from peer-reviewed literature. Anybody working with folks who have behavioral control problems, you would probably do very well understanding and implementing autonomic nervous system regulation strategies into the good work you're doing. Taking a look at this, people with bipolar disorder, personality disorders, eating disorders, people with panic attacks, people who disassociate, and the list goes on. They may be dealing with higher levels of autonomic nervous system dysfunction, which may trigger more behavioral problems as well. Understanding this, obviously, early intervention is key. So anybody here working in early childhood development, education, prenatal health, working with expected mothers, the more we can learn about this topic early on in life and really infuse this into our training programs, it's only going to make us more aware as that person gets older if maybe they're dealing with some of these things. So just something to take into account. If any, we have any professors here, trainers, coaches, the more you can implement this kind of knowledge into your training protocols, into your curriculums, into your workshops for your staff, it's only going to enhance the good work you're already doing. Dan, before I get to part two, I'll park the brakes here, my friend.
Does anyone have any questions or comments?
There's a question in the chat.
I think the question reads, will these symptoms come and go, or will these symptoms always be there?
Yeah, they can definitely come and go based on a variety of circumstances. And just one would be your stress level. How much sleep did you get the night before? There are many things we can do to make this better as well, which we'll talk about in a little bit. So Just because someone has autonomic nervous system dysfunction doesn't mean they're always going to be dealing with it, or maybe they know how to manage it and their nervous system is very sensitive still, but they've learned routines that can really keep it under bay. Maybe it won't 100% always go away, but I think we can bring it from a 9 all the way down to a 2 or 3, or maybe even less in some cases. If we follow strict protocols, we're working with appropriate providers, and I'll show you a whole bunch of things to think about. It's complicated. A one size fits all approach doesn't work. And we have to look at the long game because these kinds of symptoms can come on so quickly, but don't expect them to go away very quickly as well. Sometimes it takes many, many months, many, many years of targeted intervention to really get a handle on these things.
Yeah, I think that multiple points you made there, obviously true for injury or dysautonomia, but also for brain injury problems. And I like how you're discussing the interaction of these brain injury problems, or how the interaction of autonomic, if you have an injury or dysfunction of autonomic nervous system, it's going to interact with other things. That's true for brain injury problems overall, but I don't want to say more true for this system, but it's just it's consistent with the nature of this kind of system in a functioning nervous system anyway. And there's another version of this that I know several people where I call it the hierarchy of symptoms, where once you have this kind of problem, it's going to cause problems with everything else, and it's like the first thing that needs to be dealt with or improved or managed for then the other problems to be improved in any way, shape, or form, because it's so domineering or has this like dominance over the other problems. And recently I put out a podcast, or when I sent this the link for this talk, I put a podcast with a woman who had injured her autonomic nervous system with her second brain injury, and the problems are very explicit and very clear. And she explains how she gained awareness of it, and those things will obviously have a almost like a top-down or highly interconnected influence on the other problems. So I appreciate you mentioning that interconnection.
Thanks, Dan.
Is light and sound sensitivity post TBI also part of the ANS disruption?
It sure can. So I hear this a lot. You can find this online talked about in blog posts and different podcasts and stuff. And if somebody with a TBI is dealing with true dysautonomia, a lot of times that person may just crave laying down in the dark in silence a lot. You hear that a lot. And again, everyone's different, but they're more sensitive to light and sound. We need to be aware of sensory processing kinds of things as well, but absolutely that could be a factor. And there's a lot of ways to manage that, and I'll talk about that in the next section after this one.
Yeah, I think for some of those with light and sound, it could be due to injury to that sensory system as well. Also, injury to the gating that that system does, where it normally blocks it or regulates it, but it can't after a brain injury. But yeah, it's super interconnected. Anyway, thanks.
Yeah, thank you. All right, well, again, the signs and symptoms of a dysregulated nervous system, they're all over the map. Everyone is going to be different, but these are some common themes you see emerge in the literature. That feeling of just feeling overwhelmed, or you have that impending sense of doom, or just great despair, anxiety, that actually may be triggered by autonomic nervous system dysfunction. Again, there's all kinds of other things going on. Sleep. If somebody has consistent sleep issues, learning about the autonomic nervous system can be very, very helpful. Gut health, again, the interconnectedness between the gut-brain axis. We have to look at this as well. A lot of body tension, circulation issues, headaches, migraine, and the list goes on. I just want to plant the seed here. Here's a term I often talk about in other trainings I give to different groups. And for some people, this may apply, but I just wanted to plant the seed to be aware of this term. It's called biological despair. So basically, what this is, if somebody's dealing with chronic stress, they don't take care of themselves, they're not sleeping good, they're losing hair, they're getting gray hair frequently, they're getting sick all the time, they may actually be dealing with something called biological despair. And this is also related to cognitive despair, social, behavioral, and emotional despair. It's a big topic to be aware of. And part of this is learning about the gut-brain axis, the HPA axis, and the gut-brain axis. We all know that chronic stress is not a good thing. It's inevitable in our world. Lots of stressors from lots of things. Chronic stress is one of the biggest drivers for more dysregulation of our nervous system. So anything we can do to get our stress level down, easier said than done. I admit that there's lots of competing interests here, but whatever we can do to manage our stress as much as humanly possible is a frontline intervention to take into account. Just wanted to show this here again. It's not just what happened after the person was born, but what was going on before the person was born, during the pregnancy process. Most of my work I do is in the prenatal world and the first 1,000 days of life. That's where I have done most of my publishing on. So it's very important to consider too. Are you working with somebody that was exposed to drugs, alcohol, tobacco products in utero? That in and of itself could throw off the nervous system. Other things to consider here. So again, we know that stress, chronic stress over a long period of time, without a doubt, impacts our nervous system. It can impact our endocrine system, so our hormones. So then this trickles down into having more somatic symptoms. So maybe it's unexplained body pain, chest pain, gut pain. This can contribute to more emotional problems, more sleep issues, more autonomic dysregulation, more executive function impairments, so problems with decision making, problem solving, reasoning. From a stress lens, so if we're talking about high levels of stress, and if that throws off our autonomic nervous system and our HPA axis, that may make the person more prone to headaches and migraine. I believe, Dan, we're doing a talk later this year on migraine. We haven't firmed up a date on that. I've been doing a lot of work on migraine now as well. A lot of dizziness, digestive health problems, and maybe full-blown panic kinds of attacks. Breaking it down a little bit further, take a look at all of these things that can adversely impact our autonomic nervous system. Too much caffeine, nicotine, even our body position, being aware of body posture, or sitting for too long of periods of time, the foods we eat, and what's our emotional state like. So the more we can recognize this, the better off we'll be. I drink just a little bit of coffee every day in the morning. And there are some days I can tell, boy, that's making me feel a little anxious. I think my nervous system's probably a little more sensitive. I can't say, hey, don't drink coffee or don't have caffeine. But for someone with an autonomic nervous system issue, caffeine is a big driver for increased sensitivity. Taking a look at this, making it a little more practical here. So if we look at this through a mental health difficulty lens, autonomic nervous system dysfunction may be a driver or a major contributor for more anxiety and depression, more irritability, more nervousness, and even apathy. We know that apathy is very common among folks with a brain injury. We know that alexithymia, emotional blindness, is very common among people with a brain injury. Could that be driven by autonomic nervous system dysfunction? And if you're asking yourself, well, how do I tackle that? Well, calming the nervous system down as much as humanly possible may be a huge intervention to consider. Let's put on our neuroscience hats for a moment. A lot of things going on here. But let's just pretend you're working with somebody. They had a lot of childhood trauma. They had a lot of fractured attachment patterns. As they get older, what do we need to be aware of? Well, these factors in and of itself have been shown to throw off the amygdala. This has a lot to do with our emotions. HPA axis, again, maybe our cortisol's off, our autonomic nervous system's thrown off, and our prefrontal cortex. If you throw a brain injury into this equation, it just gets more complicated. When you study brain injuries, these would be four big topics to really start knowing as much as you can about these topics because it will play a huge role in the management and treatment of a brain injury. Maybe the person you're working with is living in a family system right now, and there's tons of chaos, conflict. Maybe there's abuse, unfortunately. The families in which we live in, and if we're dealing with tons of conflict and emotions, that in and of itself has been linked with more autonomic nervous system dysfunction. We know that post-traumatic stress disorder co-occurs with some people who've had a brain injury. If you work with people with PTSD in and of itself, the overwhelming majority of people with PTSD are going to have autonomic nervous system imbalances on some level. So a targeted intervention, if you're trauma informed, I think it's equally important to become autonomic nervous system informed as well. Maybe after a trauma, and the trauma could have been from a brain injury. After the trauma, the person is now dealing with post-traumatic frontal disruption. If you're interested in this topic, I would recommend going back to the talk I did for Dan last year on circadian rhythm misalignment. So basically, somebody had a traumatic incident. After that traumatic incident, they're not sleeping good. They're up all night. They're sleeping during the day. Their circadian rhythms are off. Those factors have been shown to adversely impact our autonomic nervous system. Significant implications for human health when we look at the circadian system. And the research is also very clear on this. If you work with folks with a brain injury, circadian rhythm misalignment is very common. So we need to also be aware of how circadian rhythm misalignment can impact autonomic nervous system functioning and vice versa. The overwhelming majority of people with a brain injury, according to the research, are dealing with some level of insomnia or other kinds of sleep wake disturbances. The more somebody is dealing with insomnia, the greater likelihood that in and of itself is probably throwing off their nervous system. So one of the best interventions that we can do to help calm the nervous system is to do everything in our power to get a good night's sleep, to rest at times during the day, especially if someone is dealing with lots of burnout and stress, taking breaks, pausing, that can be very helpful. Treating sleep apnea, that's a huge topic to be aware of. Did a talk on that as well for Dan in the past. So obstructive sleep apnea is very common among folks with a brain injury. But if you take brain injury out of the equation, if somebody's just dealing with obstructive sleep apnea in and of itself and it's not being treated, that in and of itself has been shown to throw off the nervous system. Alexithymia, Dan, I know you've done a lot of work in that. I've done a lot of publishing, a lot of talks on this topic. Half of folks or more with a brain injury are dealing with some level of alexithymia, according to the research. And alexithymia is emotional blindness. That is when someone's going to have a hard time naming, labeling, and making sense of emotions. When that's the case, alexithymia may actually trigger more autonomic nervous system dysfunction. It may be a factor in more gut health issues. It may trigger more anxiety and depression, and the list goes on. Lots going on here. But when we're studying alexithymia, difficulty describing feelings to other people, emotional unawareness, it could be a factor in social attachment issues, and the list goes on. It's a huge topic to be aware of. Chronic fatigue. So if someone just goes and pushes and they're exhausted all the time. Or maybe they're sitting, prolonged sedentary behaviors. Those two factors in and of itself can also throw off the nervous system. So learning fatigue management and not engaging in prolonged sitting are two practical interventions. Again, easier said than done. Maybe somebody with a brain injury has a lot of mobility issues and there's some safety factors there, but just be aware of these two variables. They're huge drivers for more dysfunction.
With that one, I want to also bring up in my experience and observation of others, because I think because people have injured their brain, the act of doing things, especially things that are hard because of what you injured, um, specifically, leads to fatigue almost, it can lead to it almost instantly. I've experienced that for years and I learned to manage that and learn to not push myself to that red zone, as I've seen people call it that now. But I think that that fatigue is a characteristic of brain injury problems. And so it becomes even more important to manage it. And its interconnection with the autonomic injury is, yeah, that's a big problem.
Yeah. Thanks, Dan. So if you are still on the fence about, well, prolonged sitting, not really a big deal. Well, take a look at this study. Chronic sedentary behaviors have been linked with so many things. It's a driver for many, many things. And it's not just prolonged sitting, it could be other factors too, of course, but it may impact cholesterol levels. It may contribute to type 2 diabetes, certain kinds of cancers. The list goes on. It may actually increase depression. So part of depression management is to reduce sedentary behaviors. I mentioned this before. I'm convinced I dealt with this for a period of time. COVID-19 may contribute to post-COVID dysautonomia. Lots of articles now are coming out on this the past few years. So just be aware of how maybe COVID factored into this equation as well. Being overweight, dealing with obesity may actually contribute to more autonomic dysfunction. So just another piece of the puzzle here to take into account. Internet addiction, excessive screen time exposure, any kind of addictive tendencies has been shown to play a role in autonomic nervous system dysfunction. Here's a little bit about internet addiction, excessive screen time exposure. Why do we want to care about this topic? Well, it may increase more social phobias. It may increase hostile thinking. It could unfortunately play a role in suicidal behavior depending on a variety of factors. Being aware of burnout. We have professionals here, parents, anybody dealing with high levels of burnout. That in and of itself impacts our nervous system. So really managing burnout. If we have any leaders here, folks working in different organizations, part of a burnout prevention plan is to also really educate your staff about the autonomic nervous system. Burnout symptoms can vary. I mean, depression, anxiety, anger, it can impact your energy levels. It can impact your feelings of hopelessness, helplessness. Burnout's a real thing. Dan, do you want me to stop here? Just keep pushing through and then stop at the end.
Any questions? There was a question in the chat, and maybe you're going to get to something related to this about can you be assessed for autonomic nervous system dysfunction? Is there testing?
Yeah, that gets complicated, and here I go with this. There's a lot to think about. So there's not a lot of true people out there that really know how to assess this or consider it, but going to a cardiologist who has the training in this, a neurologist. But if you look at like how does someone actually truly get diagnosed with dysautonomia? And maybe it's a full-blown kind of disorder. Well, a neurological examination would likely be part of that. They might do some eye tracking testing. They might do a bladder ultrasound. There's a lot going on with the bladder and the communication it has with the autonomic nervous system. You'd always want to rule out sleep apnea. That's a huge factor. Looking at frontal lobe functioning. Maybe the person has dealt with some infections. You really need to dig into that. Could it be a Lyme's disease issue? Could it be mold? Could it be post-COVID dysautonomia, as we spoke about before? Looking at inflammatory markers, nutritional status. Very, very important to consider the client's metabolic health. If that client is dealing with metabolic dysfunction, that's a huge driver for this. So that would be like problems with blood sugar dysregulation, cholesterol issues, blood pressure, things of that nature. Maybe they will do different kinds of brain scans, ECGs, things like that. There's all kinds of things. There's if you Google the tilt table test, that's a classic test they use to test for dysautonomia. And there's all kinds of other things, lab work, blood markers, looking at thyroid functioning, vitamin deficiencies. There's many, many more. So a lot of things going on here.
With the bladder connection and regulation of, having a pee or controlling that, is there any specific test for that?
Well, they might do a bladder ultrasound. That would, yeah, doing that. And the question is, okay, well, how does dysautonomia relate to the bladder? Well, if somebody has dysautonomia, they may be more likely to wake up through the night having to go to the bathroom. So there's a big interconnectedness between the neurocircuitry and having to go to the bathroom. So another team member in the equation is to work with somebody who understands those topics. So qualified medical doctors, mental health plays a role here, physical rehab, PT specialists, sleep doctors, gastrointestinologists, nutritionists. It's a team of people, and it's not simple targeting this, especially when we're talking about brain injury.
And the people that I've met, I can share because a lot of the symptoms you're describing, I have stuff like that too, but I think that you can injure other aspects or have other problems that lead to those same symptoms. But the people that I know who clearly have injured their autonomic nervous system, they have an array of problems where there's problems with salivation, problems with, bladder control and other things that are otherwise they're connected because of the autonomic nervous system connectivity of them. So I think they have a more pronounced injury or a clearer form of dysautonomia. But I think there could be a lot of smaller injuries or dysfunctions to this. People who have the POTS type version, it's a very dominant. They're out. They're like going unconscious when their system gets sort of activated in certain ways.
Cannot agree more. So, well, we need a holistic approach. A one size fits all approach doesn't work. We got to get to the root causes. There's so many drivers for this, and I've presented many of them today. By no means it's the only. When we're talking brain injury, it gets a little more complicated. Maybe the person was dealing with autonomic nervous system dysfunction before they even sustained a brain injury, and that just made it even worse after a brain injury as well. When we look at it through a holistic lens, we need to look at the mind-body connection, the whole person. Maybe it's the biopsychosocial model. We're looking at biological factors, social factors, psychological factors, environmental factors. What are some just basic things to think about from a holistic lens? And again, talk to your doctor. For some people with a brain injury, doing yoga might not be feasible. It could be even dangerous in some cases. I'm always a fan of working with a nutritionist, a dietitian. Maybe it's you really want to be aware of hydration status. Most of the best practices in helping calm down the autonomic nervous system always talk about the importance of making sure you're staying hydrated with plenty of water. You want to be aware of electrolytes and sodium levels, being mindful of rest. But again, you got to do this in conjunction with a healthcare provider. Whatever we can do to promote wellness in our lives, that's good for anybody. Good self-care, taking breaks, maybe it's practicing mindfulness, really taking a look at what kind of foods you eat, the people you're around. Do you have a good healthcare team you're working with? Here's some other things you'll find in the literature on how can we activate the parasympathetic nervous system. So helping our bodies feel more relaxed. Well, take a look at this. We've talked about a lot of these already. Get good sleep. Reduce screen time exposure. That's a huge driver for dysregulation in our nervous system. Laugh, be around positive people, exercise when appropriate, limit your processed food intake, limit sugar, really be aware of our circadian rhythms. Maybe it's targeted lifestyle interventions. So working holistically, maybe it's through that lifestyle medicine lens. We did a talk, Dan and I, a few months ago on how to have a lifestyle medicine approach and why it's so needed when we're talking about brain injury management and intervention. Again, if you have a lifestyle intervention approach, you're focusing on reducing sedentary behaviors, you're moving more, you're eating healthier, you're maintaining appropriate weight. Here's a model, not necessarily for brain injury specifically, but I think this is a model that we can apply to any field of study. But this is a really nice model that just gives some good framework of different things to think about. We want to promote positive friendships, cultural identity, develop good self-worth, stress management, exercise, nutrition, positive humor. Definitely add this to your reading list if you're looking for just a practical model to kind of go by. It has many different domains to consider. Any of you who are trauma informed or want to become trauma informed, I really think you need to learn about the autonomic nervous system. Obviously, you want to learn about attachment theory. You want to learn about self-regulation, executive function. But if you really want to understand and help people overcome their trauma, you also need to learn about the autonomic nervous system. I do a lot of work in this area too. It's a field of study called psychogastroenterology. I'm actually launching a podcast through my employer in February called the Psychogastroenterologist, and we will be doing talks on all things related to gut health issues. And basically, this field of study is really encouraging folks in the mental health arena to really learn about psychogastroenterology and the interconnectedness between gut health and mental health. I do think this field of study should be applied to the brain injury world as well. One of my master's degrees is in applied clinical nutrition. I'm not giving nutrition advice today, but again, work with a dietitian, nutritionist. There's so many studies out there that point to the fact that nutrition does play a vital role in brain injury rehabilitation and management, and it also plays a huge role in helping the autonomic nervous system regulate more effectively. And in a nutshell, it basically says eat more fruits and vegetables. That can play a role in helping our nervous systems work better. When we talk about nutrition, obviously good nutrition helps improve mental health. How does it help improve mental health? Well, it lowers inflammation in the body. It can help the gut work better. It reduces that oxidative stress we spoke about before. And it can play a role in helping our mitochondrial health work better. So that basically, this is at the cellular level of energy. So if anyone's dealing with tons of fatigue, the more you can learn about mitochondrial health, that may be beneficial as well. We know exercise is great. Did a talk for Dan previously on the use of walking interventions for folks with brain injuries. Again, there's many variables to take into account. If somebody has a brain injury and they want to start an exercise plan, you need to do that in conjunction with a qualified exercise professional. But generally speaking, like just if we look at the research on people that go for daily walks, their mood's better. It does help their autonomic nervous system balance out more, and it can reduce their symptoms, depression, anxiety, burnout. Yoga is a great way to calm our autonomic nervous system. Tons of research shows engaging in regular yoga practice great for so many things, including anxiety, depression, pain management, even combating diabetes and hypertension. Mindfulness, practicing mindfulness. There's all kinds of mindfulness techniques you can do with professionals or do on your own. The more you can practice mindfulness, that has also been shown to calm down that nervous system and reduce anxiety and depression and emotional regulation problems. If we look at mindfulness through a neuroscience lens, why does that help the human body and the brain calm down? Well, engagement in daily mindfulness has been shown to help calm down the amygdala. It helps increase brain connectivity, amongst other things. This is really good stuff for the whole brain and body. Self-compassion, being around positive people, just being kind to oneself is another practical intervention that can help regulate and calm our nervous system down. If you look at the self-compassion literature, look at all the potential benefits that can result from practicing regular self-compassion. It might be a great way to help people quit smoking. It's a great way to promote healthy eating. People are much more likely to go to their medical doctors and follow through with their appointments. Other benefits of practicing self-compassion. Great way to lower stress. It's a great way to promote health promoting behaviors. So self-compassion interventions really are medicine in and of itself. Getting out in nature more, reducing screen time exposure, just being in the woods or being around trees or plants or gardening. It's a great way to calm the nervous system down. Learning about proper breath work, working with a professional who can teach people how to breathe properly is another practical intervention, which is a component of mindfulness and meditation, which can also calm the nervous system down. Maybe another intervention you want to consider is working with a music therapist, an art therapist, an equine therapist. Those modalities can be fantastic too for our nervous system. Gardening, therapeutic gardening, wellness gardening, healing gardening, whatever you call it, that is a wonderful intervention if we can get people out and doing these kind of things. Research has also shown that's a great way to help the autonomic nervous system work better. As we get ready to wrap up, just being aware too, looking at our own day-to-day lives, whatever we can do to engage in positive self-care, that's great for our brains and our bodies. And we all do self-care differently. But the more we can eat healthier, exercise more, capitalize on sleep, be around positive people, take more breaks, have good limit setting, good boundaries. These are all great things that can help us. And these are just some other nervous system regulation strategies you'll find in the literature. Journaling may be helpful. Visualizing one's emotions, deep breathing, positive social connections, promoting increased self-awareness, self-compassion, enhancing gut health, getting out in nature more, maintaining appropriate blood sugar levels, and many, many more can be so good for our nervous system. Thank you so much, everyone. Dan, thanks so much for having me back. I'll stick around if we have any thoughts, questions, concerns.
Thank you. Yeah, this is good. And there's been some chat activity. So first of all, does anyone have any comments or questions? Nancy, do you want to read what you had posted?
What I'd like to share, Dr. Brown, is this take on mindfulness that seems to be wholly misunderstood by those who are really being actively mistreated. Healthy boundaries don't do it because they're not being respected. And mindfulness brings up more outrage, not peace, because mindfulness means be more aware of what is, and what is invisible to the people around us who are not supportive, not seeing, not understanding. So I just wanted that to be said out loud, and I'm very curious about what impressions you have because I enjoy your work. I'm grateful for your research and also really happy that you feel so good about nutrition and nutrition professionals.
Yeah, no, thank you, Nancy. So your question is my thoughts on mindfulness and
And what I shared about how mindfulness does not bring peace for people who are in these mistreated situations with brain injuries, which is very common but not often brought to the table.
Uh, Sounds like that's trauma. So we need to recognize that trauma is valid and stigma and marginalization and
And I mean active, not past. So the being aware that I'm safe in this moment isn't really what is healthy because it's not true. We're actively sometimes in these brain injured situations being harmed by our care providers, if we
yeah, if
even have
anyone's
them.
being harmed, obviously that's terrible, not good, and it may reach the level of criminality where law enforcement or adult protection may need to get involved, and safety has to be the foundation if someone doesn't feel safe.
Right. And so, but the model is just get mindful and you'll realize everything is fine. So I'm speaking this out loud because mindfulness is often being used, in my view, inappropriately.
And I just want to add to what Nancy is saying for the brain injury people that I've met and that are dealing with brain injury problems. The term that has come up from the discussions is called constant but changing. The problems are constant but changing, meaning the brain injury problems are still with the person. And then when the outside world or people you try to work with don't understand what you're dealing with, they're not being abusive, but they're certainly not being understanding and supportive. Nancy and I have discussed this in two podcasts, and Kim, who just came on, in one of these seminars, she shared her problems, and it was like it reminded me of the ways I was in the first 7 years trying to find help with my cognitive problems. So, going back to Nancy's point, yeah, when you're mindfully aware of a really crappy situation, it doesn't really help, or it helps in certain ways because you get a sense of what's happening, but it doesn't help with what's happening. I don't know. Or going back to your question, what are your thoughts on that? Because it's a tricky situation, not on the radar often of what is talked about with mindfulness. Oh, Holly is here.
I'm probably misunderstanding. I mean, I get what you're saying. I don't I maybe it's my brain injury, but I think of mindfulness more as the activity of calming the system down, whether it's doing a calming meditation on YouTube for 5 minutes or that's how, so maybe I'm misunderstanding how you're approaching mindfulness. But I think of mindfulness more as the activity of calming the nervous system down via some tool. But I understand what you're saying. It's hard to do those kinds of things when you have people in your life that are possibly reactivating your nervous system all the time. So maybe that's more the point you guys are getting at. And I'm sorry if I'm misunderstanding. I do have a brain injury as well. So, um,
May I comment? Because
yes,
Holly,
please.
you are correct in the intended meaning, and my speaking up is it's not a match for the word used.
Gotcha. Gotcha. Okay. Makes sense now. Thank you, hon.
Kim, any thoughts?
Yeah, thank you, Nancy, for bringing this up. And thank you for this podcast or this presentation today, Dr. Brown and Daniel, to bring more awareness. Because along the mindfulness, I taught mindfulness before my accident. I needed those people around me that were calm, that had a sense of mindfulness. And I didn't, unfortunately. And I just want to speak to what Nancy had brought up. I find there's two flavors if I keep it basic for my brain injury and hopefully for others, is that I have practitioners that did not have a clue about mindfulness nor regulation. They were not trauma informed at all at the iota and just would throw things back at me like, oh, you're not breathing. And I'm like, I didn't know what was going on. I needed facilitators that could actually help me to regulate or to lead me in the right direction. Unfortunately, I did not have that early on or even midway at 11 years post accident at this point. I did have what they call themselves as concussion professionals or brain injury professionals, which I find that to be a very loose term, and I think a lot of survivors may relate to this, is that I had a brain injury professional that was just breathe, just breathe. What the hell does that mean to me when I'm dysregulated? And I haven't even learned to acclimate with my parasympathetic nervous system at that point. Or flash a paper in front of me that she showed one time of how the system gets out of control. I didn't know what it said the first time. Then she's flacking in front of me because I'm crying and I'm overwhelmed. So, but she studied mindfulness. It's sticking in a book out of her head somewhere in the college that they skimmed over it, but she's not actually creating a mindfulness situation for someone that needs that, especially for somebody who's a brain injury professional in a concussion clinic, who's a neuropsychologist. Blew me away. So, fortunately, after several sessions with her, I will slowly pick up. So, I needed to make it a teachable moment for her. And fortunately, she understood that I was an intelligent woman with a background in exercise physiology, and pointed to her where my injury was. And perhaps because of my injury, I'm not regulating and I cannot force myself to regulate. That she turned white when I said that to her. So I do believe there's a lot of uneducated professionals out there that might throw mindfulness out or something where they just say breathe. And I thought, well, what do you mean by that? I'm trying to relearn how to breathe. So I think there's some that are totally clueless. Well, I think there a lot are clueless. There are some that do get it, and I have found a couple of those, and I appreciate them to the max. They do listen, they have presence, but we are dealing with, I think, a large population of practitioners that really don't, they are not having mindfulness in their own lives to understand what that means within their soma and their own systems to be able to create an experience for someone who doesn't have the abilities to regulate. That's all I'm going to say. My 2 cents. Thank you.
Thank you, Kim, so much. Nancy, thank you. Holly, thank you. Big discussion. So sounds like Dan, you're gonna have to do one on mindfulness and TBI sometime.
Oh, I have a whole well, okay, so first I just want to say that this is a good example of a discussion between the I see it as two sides. Brain injured people have specific brain injury problems that they then have to manage, and then people without a brain injury don't have those problems, and since those problems are invisible and truly unimaginable, you can't a discussion can happen where the two sides are not actually meeting. I just put so with this talk during Jerrod's presentation, I put multiple of Jerrod's presentations that he brought up, the ones on sleep, the ones on, I have one from alexithymia with Dr. Don Newman. I put them in the chat, but I also put these examples of brain injury discussions I have with brain injured people about their invisible problems because it's not invisible when it's your own brain. And so mindfulness, yoga, all these, aspects, the diet, the things that are in lifestyle medicine are super beneficial for brain injured people, but brain injured people are dealing with brain injury specific problems. Those are in those podcasts. I just put them up, so please check them out. And yeah, we could definitely do a mindfulness talk. I just want to share that in my experience, I use mindfulness to be accurately aware of my brain injury problems and then work to improve them. The three examples on the top of my head are literally rebuilding my cognition, and I was just mindfully, constantly aware, and then breathing about it at night of what my problems are, and then learning how to baby step approach it. Also, the fact that I was no longer myself, my mantra became, my mind is not my mind, and I need my mind back. And then the third example that was the last 7 years of my life is using mindfulness to deal with my emotions, which weren't existent because of alexithymia. And during the first 2 years of that, I would put myself in a state of panic attacks as I was learning how to feel again. So mindfulness with brain injury problems, you have to be really mindful of what you're dealing with internally. And no one understood what I was dealing with on the outside. It was kind of crazy making, but I'm still here. Any other thoughts? Any other questions? I think this is a good discussion, showing the two different sides.
Thank you, everyone. Dan, thank you. Again, here's my email, folks. Reach out if you have questions. And I think next month, Dan, we're doing Lego therapy, Lego
Yeah,
interventions, right?
I'm excited about that one, and I look at it as the goal is not to do Lego. The goal is to improve parts of what you got injured after a brain injury. I mean, well, maybe someone's goal is to do Lego, but I always looked at it as what are the point of these therapies to improve other aspects. And I encourage the people here who are clinicians that don't have a brain injury, check out at least one of those podcasts. As soon as you listen to one, it's like, oh, this really is different from what other people are talking about. And each person can talk about their brain injury problems, is what I have found. So thank you very much, Jerrod. Can you make me the presenter? I'll stick around and talk to anyone who still wants to chat. But otherwise, thank you all.
Just trying to figure that out, Dan. Let's see.
Is there a, if you can click on the three dots above the square that I'm at and it says make host. But if not,
No,
I
I
click
don't
on
see it.
you. I click on you and it says to make you host. So maybe I am the host. Okay. Yeah. Thank you, Jerrod. Thank you for your
You're
time. And,
welcome.
all right. We'll see if,
Thanks, everyone.
yeah, thanks.
Thanks,
Bye.
Jerrod.
Thank you all.
You're welcome.
Okay. I'm still here. Uh, does anyone want to talk about this? I feel like it's a good, I
So yeah,
see
my
it.
name is David.
Hey, David.
Can you hear me?
Yeah, we can hear you. Hi, David.
No, I was just curious because I had I was diagnosed with Julian-Barré syndrome, and at the same time I had a diagnosis for an acquired brain damage, and I don't know what that you know. I don't know. I just was curious about any thoughts about that or
What is
which,
the
but
first, yeah, what is the first syndrome you mentioned?
it
I
was
don't,
the Julian-Barré syndrome.
and what is that? Or I don't know anything
Uh,
about it.
it's a neurological, they say, a neurological disorder that kind of impairs the ability to move. Like it weakened my limbs. I couldn't hold myself up,
Oh,
couldn't
wow.
walk. Yeah. But I think of curiosity was like that acquired brain damage. As opposed to like a traumatic brain damage, maybe caused by an external force. That was my understanding.
Yeah, I think that in my perspective, and this is not something I've learned, this is something I've observed as I've talked to different brain injury people. You can have
Yeah.
all kinds of symptoms like stroke, anoxic brain injury, acquired brain injuries of different types, and traumatic brain injury. I think they can lead to all similar types of problems, and that inability to control your body or regulate your body. That really reminds me of in this talk series, there was a guy, doctor or not, he wasn't a doctor. His name was Steve Carnes. He's a ex-military guy, but he had a brainstem tumor, and when he got that removed, he lost the ability to control his body. And he talked about it in great detail, and he used a neurodevelopmental protocol to rebuild his body control. And I mean, when he talked about it in this talk series, I could send you that one. It was injury to the body's ability to move and control. And he's like, I could feel gravity, and he couldn't really do much. Um, from my perspective, what you're describing, it could be that that diagnosis is due to injury to that system.
Yeah.
In my podcast, the thing that I do is very clear. It's like person with a brain injury, what are you dealing with? And then
Okay.
they describe what they're dealing with. And if you're dealing with that in your body, it could be injury to your body's regulation. It could be injury to your ability to control and move, and because
Yeah.
that is a brain function. So but that's the perspective I have on all this stuff. You want
Okay. I
I'll
appreciate
send
your
yeah,
time. Yeah.
I'll send you that I could put that talk in the chat right now, if you're still here.
Oh, yeah, I'm here.
Yeah, cool. Let me find it. Huh. Any other thoughts? Let me get it. 1 second.
Sure.
Before this seminar, I was talking to Jerrod about this gap between the brain injured side and the unbrain injured side, and it happens a lot, and it's been happening in this talk series lately. And I said to him, I have enough examples now to address this, but I have to like, I don't know, collect them all. I don't know what I'm going to do. But and he
Mhm.
said this talk is going to lead to that as well, and so and I think it has. So yeah, it's I guess it's frustrating, but it's good. I don't know. Um, okay, here's the talk. I'm gonna send. I'll just put it in the chat.
Okay, thank you.
Hey,
Yeah,
Dan, can I ask a question?
yeah.
Does Dr. Jerrod Brown come from more of
Yeah, I
a
think it's good.
mental health lens or more of a physiological medical lens, biological lens, if that makes sense? I don't know if I'm saying it right.
I think the lens that he comes from is unique, but
Is it a combo?
it's a literature informed. Do you know Dawn Corbelli? She has a brain injury
Yeah,
daughter. We were talking about him because she led me to him. I wanted to find a talk on confabulation, which is something that her daughter deals with.
right,
We were joking how
right,
he's the most educated person we've ever met. I think he
right,
is aware of he's like on the border of what the unbrain injured people know because he's aware of the problem and he has a PhD and 6 masters, and it's always trying to gather as much information and understanding about this. But I've said to him over and over again, what you're studying doesn't talk about what we're dealing with because it's not in the literature, it's not on the radar.
right.
Um, Meaning, at the lifestyle medicine seminar, my friend Nick was there and a few other brain injury people were there. Nick has bilateral parietal lobe subdural hematomas, injury to
Okay,
his self, injury to his body, injury. He has a lot of things, and he was listening to that information and finding it beneficial. But then
yeah,
unbrain injured people that were clinicians would be like, oh, so this lifestyle medicine lecture leads me to think that people with brain injury and people without brain injury, they're dealing with the same thing. And nothing in Jerrod's presentation had to do with the brain injury specific problem. So that's why they arrived at that conclusion. It really was kind of crazy to see.
right,
I
right.
think
Well,
the other thing he does is he does a lot of trainings for clinicians, pushing because he's dealt with the clients and then he trains the clinicians. So he's probably a mix, but also he's sucking up all the information that's out there in order to make sense of what still hasn't been made sense of, is how I look at his
right,
perspective, which is why I appreciate his perspective so much because he doesn't have a brain injury. He has the outside world's understanding.
right. Because I've gone well, whenever I mention the word dysautonomia, because we've talked how the brain
Yeah.
injury, I did not have it before the brain injury, and then I got it immediately after the brain injury.
Oh,
The
it's a
dis,
brain injury
the,
symptom for you.
yeah, the
Yeah.
dysautonomia and what have
Yeah.
you. But it's not as well known. Like a lot of clinicians, a lot of clinicians, they look at you like they've never even heard of the word dysautonomia. Like
Right.
it's a brand new whatever, even though it's a very basic umbrella term and it seems like it would be obvious, they don't even really know anything about it. So it's kind of new to their brand new, some of them to their awareness and stuff. So that's why I'm always looking at like when I see lectures, and maybe it's just me, but it's like I want to, you know, for me personally, I want to get into okay, what is the physical molecular thing that is causing this? Is it lack of oxygen? Is it, I'm always my brain's always working from how can I fix this on a physical level?
Yeah. So that them being unaware of it is consistent with literally everything I went through in the
Right,
first years, except
right,
for like 2 therapists that knew only the
yeah,
thing that they knew. But as soon
I
as you
think,
talk to them about outside of what they
yeah,
know,
I
they
think
treat you in the
99%
system.
of,
Yeah.
and this is my bias, but I think 99% of brain injury professionals do not know anything about actual brain injury.
Yeah, I know. And that's been
And you and I have talked about that as well. But yeah, yeah, I'm right there with
it
you,
was
Tim.
my big
I've
and
experienced it over and over and over again, and
me
I've
too.
only got 4 years in so far. So
The nature of how I think about it, and this is like a collective umbrella, but I think of it as injury to the system that's in the brain that leads to this process, whether it's language or emotion or thought or executive function. They know about speech, they know about
right,
certain movement, but David, you should really check out that talk because the way Steve Carnes describes it, he dealt with the exact same thing, and then he bumps heads with these clinicians, and he gets frustrated, and then whether or not you injured it through a chemical or a brain injury that was physical or something else, you now live with this thing being injured in a constant way, and
right,
it
Yeah.
can be improved. And he did, and so Steve describes this really small progression of rebuilding it, and he uses the development that a baby goes through to rebuild it. And I did that with myself with my cognition, but I didn't know that was what I was doing because the only thing is like, what is the only thing you can do becomes the first step. And then once you can do that, you repeat it well enough, then you can do the next step. And the other thing about my podcast that I've found about 5 people that have gone through this kind of process, they describe it in a similar way. And Jamie Crazy is one of them. That's a really good podcast. So I'm slowly like, it's like I'm gathering all the things from the brain injury side. I'm gathering all the things from the unbrain injury side. I need to find a way to filter it and all, but the work to improve it is a very slow process, and equally important is the work to not make it worse, because that can happen so easily as we try to live our lives of whatever you want to call being normal. And that learning to not make it worse is a lot more important in certain ways. As a neuroscientist, I did my PhD at a cellular systems level. I was like trying to make sense of what the hell is the brain to begin with. The level of connectivity that the cells, the pathways and all this stuff has is only now being discovered. So at that
right,
point, after I studied that for about 12 years, I I said I kind of like I wash my hands of this and let me focus on what I know based on my brain injury experience and what I know Nancy knows, what I know Holly knows, what I know because every brain injury person I talk to is like this is what I'm dealing with constantly. So David, that's why what you described with that syndrome reminds me
Yeah.
of injury to that part of yourself, and then you have to learn to manage it and
Yeah.
the improvement of it is very strange. But it's possible. It's out there. So